Rapid and accurate acquisition of basic diagnostic information through the innovative concept of point-of-care ultrasound can have significant benefits for patients' health outcome that includes reducing mortality and medical legal risk scenarios. The concept of point-of-care ultrasound has become widely accepted as it gives health professionals useful clinical information almost immediately. The POCUS is a pocket-sized device which comes at a cost of 12,800 Namibian dollars.
Well, it can image most soft tissues and organs in the body, both normal and abnormal, all the way from the heart to the limbs, to the lungs. It doesn't see very well inside skulls because the energy can't get through the skull itself. But anything outside of the skull, it can image in a two-dimensional, three-dimensional plane to determine abnormalities at the bedside. You bring the radiology lab to the patient, whether they're in a rural clinic, in a major hospital.
Engineering and biology professor Dick Green and 3 medical students from the USA are now in the country to change the face of medical diagnostics by giving exposure workshops to particularly medical students on point-of-care ultrasound in the public sector.
Get them technically proficient at the skill, because it's a skill like using a stethoscope or a physical exam, but it allows you to look inside the body. So number one, we want to train them appropriately, because training is absolutely salient and key. And number two, we want to equip them. So when they go out for their community service and their internships and their residency and ultimately their practice, that they'll have a unit in their pocket.
The training program is yet to be designed so as the identification of trainees to follow after the awareness presentation to the parties of interest.